Officials at the National Dengue Control Unit urge people to refrain from attempting to diagnose people showing symptoms of illness sans medical expertise. They say that both dengue and COVID-19 patients develop similar symptoms. As such, they call on the people not to self-diagnose and instead seek medical advice.
උණ ඇඟපත වේදනාව මේ රෝග ලක්ෂණ ඩෙන්ගු සහ කොවිඩ් තත්ත්ව දෙකේදීම අපිට දකින්න ලැබෙන්න පුළුවන්. තීරණය කරන්න හොඳ නැහැ නිවසේ ඉඳන් උණ හැදුනම මට තියෙන්නේ ඩෙන්ගුද මට තියෙන්නේ වෛරස් උණක්ද මට තියෙද්දි කොරෝනාද කියලා. තීරණය ගැනීමට මේ රෝග ලක්ෂණ තියෙන. එතකොට හැකි ඉක්මනින් ස්කම්ලත් වෛද්‍යවරයෙක් වෙත හෝ රෝහලක් වෙත යොමු වන්න. එතකොට එක රෝග තත්ත්වයක් තියෙන කෙනෙකුට වෙනත් කිසියම් හෝ රෝග තත්ත්වයක් ඇති වුණොත් සංකුලතාවලට යෑමේ හෝ බරපතල තත්ත්වයක් ඇතිවීමේ හැකියාව වැඩි. නිසා ඩෙන්ගු කොවිඩ් තියෙන රෝගියෙකුට ඩෙන්ගු වැළඳුනත් ඒ තත්ත්වය තිබෙනවා. එතකොට ඒ තත්ත්වය අපිට ගෙදර ඉඳන් පාලනය කරන්න බෑ. එතනදී ඒ තත්ත්ව දෙකම එකවර ඔබට තිබෙනවද නැත්නම් පසු ආවද කියන එක තීරණය කිරීමේ හැකියාව තියෙන ඒ පිළිබඳ මන අවබෝධයක් තියෙන වෛද්‍යවරුන්ට.
In the meantime, with Sri Lanka due to receive 1 million doses of Sinopharm vaccine on the 6th of June, it was announced today that the public will be able to receive the second dose of the Sinopharm vaccine from the 8th of June onwards. Chief of the National Operations Centre for the Prevention of COVID-19, Army Commander General Shavendra Silva, made this announcement today, saying that a person who has already received the first dose can go to the same vaccination centre where the first dose was administered for his or her second dose. Yesterday, 65,104 persons were administered with the first dose of the Sinopharm vaccine, raising overall vaccinations from the China-made jab to 666,612. Meanwhile, the number of persons to have been given the Sputnik vaccine also rose to 16,664 after 1,680 persons were administered with the jab yesterday. Yesterday also saw 193 persons being given the second dose of the AstraZeneca vaccine as well. During the inoculation drive, there had been several incidents of people being left inconvenienced and disgruntled owing to inadequate doses of the vaccine made available to certain vaccination centres. Though Deputy Director General of Education and Research at the Ministry of Health, Dr. Hemantha Herath, offered an explanation into this, it seems though the inconvenience is inevitable to a certain degree.
එන්නත සැපයුමේ තියෙන අනිශ්චිතභාවය නිසා තමයි මේ සියල්ලම සිද්ධ වෙන්නේ. මේ රජයේ පාලනයෙන් සම්පූර්ණයෙන් තොරයි මේ එන්නත් සැපයුම් සම්බන්ධයෙන් තියෙන අනිශ්චිතභාවය. මේ හේතුකටගෙන තමයි අපිට සීමිත ප්‍රදේශවල සීමිත ස්ථානවල පමණක් මේ එන්නත් ලබා දීමට සිද්ධ වෙලා තියෙන්නේ. ඒ නිසාම ජනතාව ඒ තැන්වලට එක්රැස් වීම වළක්වන්න බෑ. එහිදී අපි ඒ නිසා තමයි ජනතාවගෙන් ඉල්ලා සිටින්නේ මේ තත්ත්වයේ තීරුම් අරගෙන අනවශ්‍ය ලෙස අවධානයකට ලක් නොවි තමන්ට අවස්ථාව ලැබෙන තෙක් ඉවසීම In
the meantime, there were allegations leveled at the government on social media claiming that people wanting to be vaccinated are forced to give their consent to receiving just one dose of the vaccine. The accusers claim that those who do not give their consent are overlooked for inoculation. At a separate media briefing today, Dr. Hemantha Herath was quizzed on the matter.
අපිට නම් එහෙම දෙයක් වාර්තා වෙලා නැහැ. ඒ පිළිබඳව එහෙම ප්‍රශ්නයක් තියෙනවා නම් අපි ඒක ප්‍රධාන මාධ්‍ය හරහා ඉදිරියේදී අපි දැනුම් දෙන්නම්. එහෙම දෙයකට සෞඛ්‍ය අමාත්‍යාංශය දැනුවත්ව එහෙම උපදේශයක් ලබා දීලා නැහැ.
In the meantime, there were 2,859 COVID-19 infections across all 25 districts of the country yesterday, with the Western Province accounting for the highest caseload with 1,602. The Colombo district yet again reported the highest number of cases with 608, while Gampa confirmed 547 infections. The Kaluthara district recorded 447 fresh cases of the virus, while Gaul reported 143 and Kegol confirmed 136. Meanwhile, 108 new cases of the virus were recorded from Kandy, while 99 came from Kurunegala, 82 from Mathura and 78 from Ratnapura. A further 601 coronavirus infections were recorded from 16 other districts. In addition, 10 imported cases were also part of yesterday's daily caseload. As for today, 1,531 new COVID-19 infections have been confirmed so far. In other developments, the Old Ceylon Nurses Union launched a trade union action by going on sick leave this morning. This was carried out due to the failure to provide proper solutions to the issues faced by nurses engaged in COVID-19 treatment. In the meantime, Sri Lanka's overall number of COVID-19 related fatalities rose by 36 to 1,441. According to the Department of Government Information, 7 of the deaths had occurred yesterday and the rest had taken place between the 2nd and the 29th of May. It added that the cause of death of 24 of the victims is COVID pneumonia. The remaining 12 had reportedly suffered from underlying health conditions, while they also developed COVID pneumonia. Meanwhile, following confirmation of the recovery of 1,915 COVID-19 patients today, the island's overall recoveries rose to 151,740. As such, the number of active COVID-19 cases in the island is at 31,802.
දසනකාන්තී චූර්ණය සහිත ලීවර් ආයිෂ් දන්තාලේපය දත්වල ඇති ප්‍රශ්න 10ක් වලකයි.